For some physicians, retirement is a time to take up golf, travel the world, or just enjoy a well-deserved rest. For Dr. Matthew Mandel, it's been just another opportunity to make a difference. As a founding member of Volunteers in Medicine Berkshires, he has spent most of the past decade helping some 2,000 uninsured and underinsured patients get quality medical care. The clinic has provided 20,000 patient visits covering a wide array of services. Dr. Mandel continues to build support for the clinic, recruiting volunteers, negotiating for lab and imaging services, arranging pro bono partnerships, and playing a key role in raising the $600,000 a year it costs to keep the clinic running. Caring for others is something he's been doing for most of his life. The son of a Navy submariner and grandson of a surgeon, Dr. Mandel was born in New London, Connecticut. Dr. Mandel, who lost his mother when he was 16, spent many hours aboard the ships his father commanded. It was there that he discovered that he liked helping out, especially in sick bay. Upon earning his psychology degree from Western Reserve University in 1967, he began medical studies in France at the Faculté de Médecine de Tours, a few hours north of his future wife Catherine's hometown of Toulouse. Upon earning his medical degree from Hahnemann Medical College in Philadelphia, he did his internship at Bryn Mawr Hospital, his residency at Boston's Peter Bent Brigham Hospital, and fellowships at the Children's Hospital and the Boston Hospital for Women. He practiced anesthesiology at Providence Hospital in Holyoke, becoming chair of the anesthesia department, and was deeply involved in the ICU until his retirement in 1996. It was in 2003, after moving to the Berkshires town of Stockbridge, that Dr. Mandel became acutely aware that not everyone in that affluent resort area had adequate access to health care. Many were low-wage, seasonally employed, or rural residents who, while contributing to the wealth of the community, were challenged to share in its health. So Dr. Mandel decided to help open Volunteers in Medicine Berkshires. The clinic opened in 2004, at first providing a medley of medical and mental health services. Dental and oral health services were added in 2005. Optometry followed in 2007. And in 2010, VIM Berkshires added acupuncture, nutritional counseling, and diabetes education. Today, 55 doctors volunteer at the clinic, with others providing pro bono specialty care, even open heart surgery in one case. Most relish the opportunity to see patients without time and insurance dictates. And he even manages to get in a little world travel and time with his family, which includes 2 grown children and 3 grandchildren. Dr. Mandel has been heard to say that this has been the best decade of his life. Thanks to his determination, many more Berkshires residents are able to cherish their days as well.
I am so very, very flattered to be in such company this evening. It's absolutely wonderful. I am very grateful to the AMA Foundation. I'm grateful to Pfizer. I am very grateful to my wife and my children. My wife and son are here with me this evening. I am very, very grateful to wonderful, wonderful people from Massachusetts who are here also this evening. It's just terrific. It was an idea. A few of us sitting around, we wanted to do something for the community, and we came to realize that there was this need right in our backyard. And we went with it. It was amazing. There were many, many challenges along the way, but it grew, but it reinforced itself. We brought, I was able to get a hold of retired people. I was able to get a hold of people who wanted to shift gears. And then I was able to get a hold of people who were in active practice and thought that the idea of what we were doing was so terrific that they began to give up a day or at least half a day of their own practice time per month to come in to volunteer because they really wanted to do what they had hoped to be doing when they set out in healthcare professions, and they love it. It's been absolutely wonderful. It's been very interesting because there are an awful lot of members of the patient population who would not consider coming to a healthcare facility, going to the doctor, and it took a while. In the beginning, we were really, at one point, I was going to put someone with a sandwich board out in front of the clinic. Really, and it's been a fascinating evolution. We have taken care of people in the community, riding the buses with active tuberculosis. We have taken care of a woman who came in for dental work by one of our 11 volunteer dentists. It turned out that she had a cardiac problem that led to cardiac surgery, which we were able to have taken care of entirely pro bono at the hospital in Springfield, Massachusetts, including a couple of nights at the bed and breakfast across the street from the hospital for her husband. We have a woman who is trying to better herself, and I have to tell you that 90% of our patients hold 1, 2, or 3 jobs. These are not people who are sitting home watching daytime television, and it's a vast array in the patient population. There was one woman who was really trying to advance herself, but her teeth were in terrible, terrible shape, and she was buying cosmetic makeup at the drugstore to cover her teeth and doing everything she could to avoid smiling during interviews. And she walked out after several sessions with a pretty beautiful mouth, a very, very grateful patient. The last thing I want to say is that this has been a lot of fun. It really has. And there is something about volunteering, something that I had never done until the beginning of all this. And it's absolutely the best. Remember that.